Hey there and welcome. Today, we're going to break down the 4 foundational principles that guide some of the most difficult, high-stakes decisions in all of medicine. If you're gearing up for your physician licensure exam or you're just curious about the thinking behind healthcare, this is the ethical toolkit you absolutely need to know.
All right, so let's just jump right in with a real-world dilemma that doctors face all the time, a situation where the right answer isn't so clear-cut. So put yourself in the doctor's shoes for a second. This isn't just some textbook question, right? This is a real situation that pits a doctor's fundamental duty to heal against a patient's most deeply personal wishes. How do you even begin to navigate that?
So here are the details. The diagnosis is incredibly serious. But, and this is the key, the patient is of sound mind, they understand everything. And to make it even tougher, they have 2 teenage kids. The stakes here are just incredibly high for everyone involved. And this is exactly why having a clear ethical framework is so important.
So, to get through these kinds of murky situations, medical professionals turn to a really powerful decision-making tool. You might hear it called the Georgetown Principles. Basically, it's a framework built on 4 core pillars. And believe me, they are more relevant now than ever as we face new challenges in medicine.
Okay, so here they are, the 4 principles at the absolute heart of modern medical ethics. Let's break each one down, because once you really get these, you can unlock pretty much any ethical question that's thrown your way.
First up, we've got autonomy. An easy way to remember this one, auto means self. So this principle is all about respecting the patient as their own person, with the absolute right to make informed decisions about their own body and their own treatment.
Next up is beneficence. This one is the duty to do good. You can think of it as actively providing a benefit. It's the principle that drives a physician to always act in the patient's best interest, to provide care that helps their health and well-being.
Then there's non-maleficence, which you've probably heard of. It's the famous principle of first, do no harm, from the Latin primum non nocere. So if beneficence is about doing good, non-maleficence is about not doing harm. Carefully weighing if the risks of a treatment are worth the rewards.
And finally, we have justice. This principle kind of zooms out from the individual patient to look at fairness across the board. It's all about the fair and appropriate distribution of care and resources, especially when they're limited.
Okay, so we've got the framework down. Now let's really apply it, starting with a closer look at autonomy and how it connects right back to that case we started with.
You see, autonomy isn't just some vague idea. It's a bundle of really specific rights. It includes things like informed consent, privacy, and, most critically for our case, the absolute right to refuse treatment, even if that treatment could potentially be life-saving. Now, this is where it gets really interesting. What happens when these principles don't agree? When they're in direct conflict with one another.
On board exams and in the real world, this is the classic showdown. The patient's autonomy, their right to choose, is often pitted directly against the physician's sense of beneficence, their duty to help. Our case is a perfect example. The patient is choosing palliative care, while the doctor knows the treatment could prolong his life. So what gives? This quote from the World Medical Association really illustrates the tightrope walk that doctors are on every single day. It shows how non-maleficence and beneficence are in this constant balancing act, forcing physicians to weigh the potential harm of any action against its potential good.
So we've seen the conflict between a patient's choice and a doctor's duty. But what about fairness across the entire healthcare system? Well, that's where justice comes in.
And the crucial point about justice is this subtle but incredibly important distinction. It's not about giving everyone the exact same thing. This chart breaks it down perfectly. Equal treatment means giving every single patient a 15-minute appointment. But equitable treatment, and that's what justice demands, means giving the patient with more complex needs a longer appointment. It's about distributing resources based on need to create a fair outcome for everybody. So, with these 4 powerful and sometimes conflicting principles, how do medical professionals ever make a final decision?
Well, the key concept is prima facie. It means that each of these principles is binding on its own, but in a conflict, one can outweigh another. There's no fixed hierarchy where beneficence always beats autonomy, for example. Every single situation requires its own careful, thoughtful balancing act.
And this balancing act is so critical that it's actually formalized in official documents, like these codes of ethics from professional medical associations. These codes provide a real, tangible framework for physicians to apply these principles, guiding them through their absolute toughest decisions.
So let's circle all the way back to our opening case.
After weighing all the principles, the resolution becomes clear. For a mentally competent adult, the principle of autonomy is paramount. So, the ethically correct action is to respect the patient's wishes and begin palliative care, even though it conflicts with the physician's desire to prolong life.
This framework is our guide for today's challenges, but the real test is what's coming tomorrow. The principles of autonomy, beneficence, non-maleficence, and justice are timeless. But as technology like AI and genetic engineering completely reshapes medicine, the question for all of us is, how will we balance them then?